CVS is a major player in the nation's healthcare system and drug supply chain. It's also on the front lines of the opioid epidemic. And tonight, that company is taking steps to try and curb abuse of the drugs by limiting the duration and dose of some prescriptions. CVS's reach is wide. Through its Caremark unit, the company manages medications for nearly 90 million people. That's about 28% of the U.S. population. Meg Tirrell has more now on CVS's new rules for opioid painkillers.
CVS Health said today it's taking new actions to try to curb misuse of prescription opioids.
If we do limit exposure to these medications, we'll have fewer people who become addicted to them. And if fewer people become addicted, they'll lead better lives, we'll eliminate human suffering, we'll even reduce the number of deaths that occur.
The chain's pharmacy benefits manager, CVS Caremark, says it will limit prescriptions of opioids for acute use to 7 days. For patients with chronic pain, CVS says it will put caps on the daily dosage based on the strength of the medicine. The company says its new policy is consistent with guidelines for opioid prescribing set last year by the Centers for Disease Control and Prevention.
The number of deaths from drug overdoses just continues to climb. It's a real crisis and epidemic in our country, and that's why everybody who's involved in pharmacy and taking care of patients needs to be taking steps to address it.
The move comes as scrutiny grows over industry's role in the opioid epidemic, which now claims more lives each year than car accidents.
There's no doubt that there simply are too many prescriptions for too many opioids in America right now.
New York Attorney General Eric Schneiderman is among those in government taking action. His office sent letters to the 3 largest pharmacy benefits managers, including CVS Caremark, last week, seeking information about their role in opioid prescribing.
We want to get information from them about how all these parts of the system work so we can understand how we can make less addictive drugs more available and cut down on the distribution of opioids.
State attorneys general and members of Congress are also investigating the role of health insurers, drug manufacturers, and distributors. But some doctors worry there could be unintended consequences to new policies like those from CVS.
Sometimes there are specific populations that rely upon these medications, specifically cancer patients. And the CDC guidelines weren't really intended for that population, but if we apply their guidelines and recommendations too broadly, we end up sometimes affecting to the detriment those specific populations.
Vanderbilt's Dr. David Edwards says CVS's change is just one of many being implemented by health insurers, distributors, and pharmacies around opioids, leading to many more restrictions and administrative headaches.
It's very time consuming. I spend probably half of my day now calling, doing peer-to-peers with other physicians that represent these companies rather than caring for my patients.
He said the key to making a dent in the opioid epidemic is making sure patients have access to alternative therapies and ways to treat addiction. For Nightly Business Report, I'm Meg Tirrell.